When you call 911, if you're in danger, they send police, HEART, EMS, the fire department. But what if you're dealing with a mental health crisis? Well, starting tomorrow, all residents in Durham will have access to a team designated and designed to help people struggling in that way. WRAL's Keely Arthur shows us how this program will work.
Durham's HEART is about to get a whole lot bigger. I'm talking about the Holistic Empathetic Assistance Response Team. Now, right now, they serve about a third of the city. Starting tomorrow, it's going to be citywide.
Tracy Jackson has what most of us dream of having, a job that he loves and fulfills his life's mission.
Our most vulnerable communities lack the support and resources that they need. So I'm here to be able to lend some healing to those who are ailing at this time.
Since graduating with a master's in social work from North Carolina Central University, Jackson has been here at Durham Community Safety Program's HEART.
Dave 321.
When someone calls 911, dispatchers, police, and HEART members assess the calls and decide if they need to dispatch HEART, either on its own or with police when necessary. Just a week into the job, Jackson saw what a difference.
911 received a call of a gentleman that was in distress. We responded and reached out to him. We made a connection with him. He expressed that he was overwhelmed. He had just lost his job at Duke that he had had for almost 20 years. He was unsure of how he's going to pay his rent. His children was also in crisis. He was a single father. But we were able to connect him to resources to get his rent paid and also provide some therapeutic support through our clinicians and peer support specialists.
He had to feel so much better after having called and getting that help.
He expressed a lot of gratitude for the HEART program.
Brian Smith, director of Durham's Community Safety, explains the citywide expansion of HEART will reach more people, but they already have a thorough system regarding who is dispatched and when.
So if you call 911 and you're experiencing a crisis, a call taker is going to answer. They're going to ask you a set of standard questions. Those questions will change a little bit based on the type of crisis that you're experiencing. If it's a suicide threat with no weapon, it's going to recommend one of our community response teams. If it's a suicide threat with a weapon, it's going to recommend co-response and other law enforcement to arrive on scene. So that's how it works. We have a great track record. You know, we've been doing this for over 16 months. We haven't had a single safety incident.
I think our commitment is to the city of Durham and our neighbors to ensure that vulnerable communities and everyone receive the help that they so deservedly need.
And this program is really doing so much good beyond Durham. Check out this map. These green pins denote cities, townships, municipalities that have reached out to HEART here in Durham to learn from them and then take those skills and bring them back to their own areas. Smith tells me that in Durham, he hopes the program is available here 24 hours a day, 7 days a week, and he hopes it becomes the norm across the country. Keely Arthur, WRAL News.
All right, we'll see how it goes. And you can find HEART's current hours at durhamnc.gov. If you'd like to learn more information, it's under the community safety section.